Hi, this is Dr. Kim, author of 9 Secrets of Health, medical director at Kim Financial Medical Centers. I've been practicing podiatry for the last 20 years, and first 5 years into my practice, that's exactly what I was doing. I was seeing patients, I started getting busy, started doing more surgeries, and I realized there's so many of my patients just had complications. They didn't heal well. When I made incision to do the surgeries, the incision became very thick scars. When I would cut the bone and move the bone in, the bones wouldn't heal for months, sometimes years. And then the joint would move, and the healing was completely impaired for so many of my patients. So I started questioning my surgical skills, and I was afraid to even go to the office. I would go to the office, I would look at the schedule for that day, and I would spot all these names of the patients who are still limping around after 6 months, sometimes up to a year after surgery. They should be much better by now, but they weren't getting better. So I got into a total depression, and I didn't want to go to work. I didn't want to go to surgeries anymore. I started really questioning my surgical skills. So one day I decided I need to find out what I've done wrong. So I took out all the charts of the people, about 50 charts, and literally laid them on top of my desk. And all the charts were very thick because they've been coming for a long time now. So charts are I was literally buried underneath the pile of charts with complications. So I started looking in the evening after the office hours. I started looking at all the charts, and I was studying and looking through. I said, what have I done wrong? And about 3 hours into my looking into charts, I became so elated. I said, hallelujah. It's not my fault after all. Well, there are times that I've made mistakes and I didn't do it right, but majority of these people were sick. These are the sick people that when I worked on the sick people, they just didn't get better. I worked on diabetic patients, hypertensive patients, obese patients, patients with multiple medications they're taking. When I operated on these people, they just never got better. So, hallelujah, I was so happy, but I started thinking, I said, well, then what can I do to get them well so that I won't have this complication? I didn't have a whole lot of answers because I've done all the surgeries, I've done all the therapies and injections, all the things that I've learned at school or during my training. I already have done that, and they have not really improved. So I started looking at other parts of the world for the answer. I started thinking about Chinese medicine. When I grew up in Korea, my mom used to go see an acupuncturist. They use these needles and herbs, and when they do that, things get cured. So I started looking at Chinese medicine, and thousands of years of history of healing without surgery or chemicals. They use herbs and they used needles to heal them. So wow, that's quite amazing. Then I started studying Ayurvedic medicine, which is a Indian medicine of history of 8,000 years of healing people all naturally by using food as medicine. As you well know, Hippocrates said 2,500 years ago, just use food as medicine. And they've been doing that for thousands of years. So I started studying how to use body type to be able to use food to cure people. That was quite amazing. Then I started studying exercise physiology, emotional healing, spiritual healing. When I studied all of this, and I realized, wow, we have all the power to heal ourselves. I was so elated again. Say hallelujah. We have all the power to heal ourselves if we do all the right things, so that we don't have to depend on drugs and surgery. Sometimes we need that, but we're depending on that a little too long. That's what I realized. So I realized that I need to really teach this so that people get healthier. So I started gathering some people, and I started doing seminars, and started doing it in year 2002. And in the beginning, we started kind of slow, and I started teaching people what to eat, when not to eat, when to eat, when not to eat, how to eat, how not to eat, when to drink, when not to drink, how to drink, how to think, how not to think, how to believe, what not to believe. And when I started teaching this, amazing things happened. People started curing themselves from all kinds of disease that they had. I've had people cure from diabetes in a matter of weeks. I get people off of hypertensive medication, cholesterol medication, all kinds of blood thinners, and all kinds of different medication. They were able to get off on all of that naturally. And also, I've even had people get themselves from terminal cancer as well. So when I started teaching this, when I started realizing so many different things that can be done if we just teach them the right information, so that patients can do all of these things on their own. So this has really changed my perception of medicine and the direction that I'm going with what I'm doing as a doctor. So my goal is to build a comprehensive foot and ankle medical centers where we would combine the newest technology of Western medicine, of great diagnostic tools and great surgical skills and emergency medical skills, and then add it into our holistic medicine of nutrition and exercise physiology and emotional healing and spiritual healing. When you add all of these things, I think we'll really be able to help a lot more people. And then effectively, we should be able to reduce our healthcare costs tremendously. Not only our doctor visits, but also the hospital visits, and also overall healthcare costs will be tremendously diminished. So not only we need to cure their symptoms of the problem, but we really need to work on the cause of the problem, so that we're not just touching what we see and their problem right now, but we really need to figure out why they're having this problem and be able to really get to the bottom of their diseases, and then so we can have a better control over all of these disease processes as well. Also, I like to add other holistic practitioners such as nutritionists, acupuncturists, other therapists into our practice, so that we can practice more holistically. When the patient walks into our office, we'll be able to really get them well from their feet up. So my goal has changed a little bit throughout the years, but basically I want to give more information out to people through different ways, producing more videos, more audio programs, writing more books, and also having more products that people can utilize to get them well. I'll be also sending out 1-minute wellness messages daily basis to get them to change just a little bit every day, so they make a really drastic change over a long-term period. So I started this wonderful journey of wellness several years ago, and I'll be continuing on this journey, and I would like to invite all of you to join on this wonderful journey of wellness. Thank you so much for watching, and I hope to see you at one of my seminars or at my office through my messages that I send out. I really welcome you to join me. Thank you.